Hello, everyone. My name is Dr. Rabin. I have a specialist in dentistry. I have a master degree in oral surgery. Now we are going to talk about effect of local simvastatin on the healing of surgically created critical size bone defects, an experimental study on sheep. Presentation outline, introduction, aims and objectives, materials and methods, results and discussion, conclusion and recommendation. As we know, we have four stages of bone healing: inflammatory stage, soft callus formation, hard callus formation, the end stage, which is the remodeling stage. The bone has capacity to heal if less than 6 mm. If more than 6 mm, which is known as critical size bone defect, needs bone graft. To restore osseous defects, we have different bone graft materials: autologous bone graft, allograft, xenograft, alloplastic bone grafts. The autogenous bone graft, which is the best one because it has osteoconductive and osteoinductive properties, but it has many disadvantages like needs second surgical sites, pain, discomfort to the patient, and etc. To solve these problems, Mundi et al. In 1999, they tested on more than 30,000 compounds. Only statin had positive effect on bone healing. Aims of this study: histological examination of the effect of simvastatin on the healing of the surgically created critical size bone defect on the iliac of the sheep. Histological effect of biphasic calcium phosphate, which is the bone graft, and comparison between them. Materials and methods: we need 6 male adult sheep, weight 70 kilogram, age between 2 to 3 years. Experimental material: local simvastatin, which is tab 10 milligram, bone graft, collagen membrane, and gel foam. For the first 3 sheep, after incision and reflection of the flap and exposing of the iliac bone, 10 defects were created, 5 on the right and 5 on the left side. For the right side, 5 defects were created, left empty, known as control group. The other 5 defects filled with the bone graft, known as test 1 group. Then membrane placed on the defects, and then suturing. For the other 3 sheep, after incision and reflection of the flap and exposing of the iliac bone, 5 defects were created. And then using of the 10 milligram of the simvastatin, crushing this tab and moist it of the gel foam with the normal saline, and then crushed simvastatin, place it inside the defect with the gel foam, and then placement of the membrane and suturing. This group known as test 2 group. Post-surgical side, the wound should be monitored for 7 days for the swelling, infection, pus discharge, and wound dehiscence. Results and discussion. The newly born format in simvastatin group is much more than biphasic calcium phosphate and blood coagulum at all time interval, at the first month, at the second month, and the third month. Why we use the sheep as experimental model? Because of the availability and the bone and joint structure of the sheep, the same as of the human, and lamellar bone, primary bone healing, and remodeling rate, and bone regeneration the same as of the human. Conclusion: the simvastatin and biphasic calcium phosphate are more effective than blood coagulant, and the simvastatin is more effective and faster, greater bone healing than biphasic calcium phosphate and blood coagulant. Recommendation: using large sample size, using immunohistochemistry to evaluate the progression of newly bone formed and healing, and using micro CT to measure bone volume and density. Thank you for your attention.